are some common policy terms in a long-term healthcare policy? Well, do you know that at least 70% of 65-year-olds will ultimately need long-term care services or support, according to data from the U.S. Department of Health and Human Services? Your health insurance policy doesn't cover long-term care, and Medicare will only cover short-term nursing home stays or a limited amount of home health care in very specific situations. Now, that's why it's important to have a long-term health care policy, but to also understand what the terms of that particular policy might be, because there's no uniform policy or plan. And you can actually tailor these to your specific needs as you are buying this policy. So let's talk about specific policy terms that I think are important for you to understand now as you're buying the policy. And if you find yourself in need of using the policy, it's really important that you understand the conditions and the terms of this policy, because that's going to impact the benefits that you're going to be able to secure. So one of the things that you need to understand is what's the definition of activities of daily living, because normally you have to be unable to do a certain number of activities before you're eligible for benefits. That can include things such as bathing, dressing, toileting, getting in and out of bed, dealing with incontinence issues. And you have to have a certain number of problems with these activities of daily living to be eligible for care. So the first thing you need to understand in terms of the policy is what will qualify me in terms of activities of daily living. Another thing I think you need to understand is the elimination period. And the elimination period is a period of time in which you're not eligible for benefits, regardless of how needy you are. And that means that maybe for 30, 60 days, 90 days, maybe even 180 days, you are going to have to pay for your own care before your benefits are going to be applicable and they start reimbursing you. That's called the elimination period. And it's not retroactive back to the first day of service. So you've got to pay for these services during the elimination period, and after the completion of the same, the carrier will then reimburse you for the services or begin the payment of the benefits. Now, there's also a fourth term, and that's a daily limit. And there can be limits on how much they're going to pay per day, and they're going to limit what's covered. So you need to understand what the nature of the services are as provided by the terms of the policy and the amount of the daily rate that they're going to reimburse. The next important term is whether or not there's a cost of living adjustment, and that cost of living adjustment will deal with increased costs for these daily services. And then, of course, the last thing that is important is a lifetime maximum. And once you exhaust whatever that number is, you're done. So you can see that there are very important policy terms that can impact what care you ultimately are going to get. And to me, there's a lot of decisions that need to be made as you're purchasing the policy, because that's going to impact what you get or not get when you have to use the policy. If you and a family member are in a situation where you need the care and you're having a dispute with the carrier about the provision of the services, they're not reimbursing you, they're not reimbursing the facility, it's time for you to call me, Nancy Cavey, at 727-894-3188 for a complimentary consultation. We can review that policy, explain what the policy says, talk with you about what's going on, look at your medical records, and devise a plan. We're here to help you get the benefits that you purchased, get you reimbursed, and get those benefits paid. If you have any questions, call us today, 727-894-3188.